I did make every effort to include the latest scientific studies. Please note though that research is constantly changing and one clinical trial cannot always cover diverse bodies and communities.
Individual responses to foods, herbs, supplements, and treatments may vary based on a variety of factors, including genetics, environment, diet, and other lifestyle factors.
Even solid clinical trials and studies tend to have an agenda or underlying bias, and despite the best intentions and efforts of researchers, the scope and purpose of scientific research will always be somewhat limited by factors such as funding, ethics, and logistical constraints. Relying on a single expert or source can be risky, as errors and biases can occur. It's best to verify information from multiple sources before accepting it at face value. Engage in due diligence and critical thinking to ensure that you are making informed decisions. If you wish to deep dive into the topic, you can check on your references posted in the description box below.
In this presentation, 5 potential health benefits of passion flower supported by limited scientific studies, potential side effects of passion flower, what you should know before taking passion flower, and what you can do if you already tried it all and followed many doctors and health gurus, but nothing worked. According to a study published in the U.S. National Library of Medicine in 2008, passion flower contains homo-orientin, orientin, vitexin, and isovitexin, a group of chemicals called flavonoids. And in a 2016 scientific review on the pharmacological effects of vitexin and isovitexin, latest research has suggested that they could be potential substitute medicines for diversity diseases and may be adjuvants for stubborn diseases or health products. Limited scientific studies support the following health benefits of passion flower. 1. Passion flower is possibly effective for anxiety. In a 4-week clinical trial involving 36 outpatients diagnosed with generalized anxiety disorder, GAD, researchers compared the effectiveness of passion flower extract with oxazepam, a commonly used medication in treating GAD. The results showed that both passion flower extract and oxazepam were effective in treating generalized anxiety disorder. There was no significant difference observed between the 2 treatment protocols at the end of the trial. However, oxazepam demonstrated a faster onset of action, meaning it started working more quickly to reduce anxiety symptoms. On the other hand, the patients who took oxazepam reported more difficulties with job performance compared to those taking passion flower extract. This suggests that passion flower extract has an advantage over oxazepam in terms of causing fewer problems with job-related tasks. In conclusion, the study suggests that passion flower extract is an effective treatment for generalized anxiety disorder. It demonstrates similar efficacy to oxazepam, but with the added benefit of causing fewer job performance issues. Because of the small number of participants, the results indicate that further research on a larger scale is warranted to gather more evidence and confirm these findings. Researchers did not conduct a follow-up assessment, though. Performing a follow-up assessment after the completion of the trial would provide insights into the long-term effects and durability of the treatments. It would also help determine if any differences emerge between the passion flower extract and oxazepam groups over time. A separate study published in the Iranian Journal of Psychiatry in 2016 evaluated the effect of passion flower extract on reaction time in patients with GAD. 36 GAD patients aged 18 to 50 years were included in this double-blind, placebo-controlled study. All participants were initially prescribed sertraline at a dose of 50 milligrams per day, which was later increased to 100 milligrams per day after 2 weeks. Then 14 received 15 drops of passion flower extract 3 times daily, while the remaining 16 participants received a placebo alongside their sertraline treatment. The results showed that there were no significant differences between the 2 groups in terms of reaction time. However, within the group receiving passion flower extract, there was a significant reduction in auditory omission errors after 1 month of treatment. Based on these findings, the study suggests that passion flower extract may be a beneficial addition to the treatment of GAD with minimal side effects. However, more research with larger participants and longer durations is needed to confirm these results. Surgery or dental procedures can cause anxiety for many people. Clinical trials involving over 200 patients have shown that taking passion flower extract for a short period can help alleviate this anxiety. And based on the analysis of over 25 clinical trials, 2 reviews have concluded that purple passion flower exhibits notable anti-anxiety effects. 2. Passion flower is possibly effective for menopausal symptoms. When women reach menopause, the hormonal changes they experience can lead to various unpleasant symptoms, including hot flushes, headaches, and emotional changes such as heightened anger and depression. And according to a 2016 scientific review, the menopause transition is experienced by 1.5 million women each year. A 2010 study looked at the effects of 2 herbal medications, Hypericum perforatum, commonly known as St. John's wort, and passion flower, on menopause symptoms. 59 menopausal women were divided into 2 groups. One group received Hypericum perforatum treatment, while the other group received passionflower treatment. The participants were assessed before the treatment, after 3 weeks, and after 6 weeks. The results showed that both herbal medications had a significant impact on reducing menopause symptoms. Symptoms such as hot flashes, insomnia, depression, anger, and headaches improved in both groups. These findings suggest that Hypericum perforatum and passionflower can be considered as alternative treatments for women who cannot or prefer not to use hormone therapy. These herbal medications can help alleviate menopause symptoms and provide relief. However, the data collected for the study relied on self-report measures, such as interviews and questionnaires. This introduces the possibility of subjective biases and inaccurate reporting from the participants, which may affect the reliability of the results. Also, the study included a relatively small number of participants and did not include a control group receiving a placebo or standard treatment. A control group would have helped to assess the specific effects of the herbal medications compared to no treatment or a recognized standard treatment. In a systematic review published in 2016, passionflower has been shown to be effective in alleviating hot flashes intensity. Also, according to a separate scientific review published in 2017, passionflower is rich in flavonoids and possesses phytoprogesterogenic properties, as well as anti-anxiety and anti-insomnia effects. Several studies have reported its effectiveness in reducing neurological symptoms and hot flashes commonly experienced during menopause, and no harmful complications have been observed from consuming therapeutic doses of this plant.
By the way, before I continue, if you're new here, I'm Jera from the Philippines. Welcome to my channel where I share my knowledge and discoveries about everything related to anti-aging, natural health remedies, dogs and cats, and personal development gained from reading research articles, scientific journals, and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing and turning on the notification bell so that you'll get notified whenever I upload new content. Also, you might want to check out my mini ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on, passionflower tea may help improve sleep quality. A randomized controlled trial published in 2011 investigated the effects of passionflower on human sleep. The study involved 41 participants aged 18 to 35 years who consumed either passionflower tea or a placebo tea for a week. They filled out sleep diaries and rated their sleep quality, and some participants also underwent overnight sleep monitoring. The results showed that participants rated their sleep quality higher when they consumed passionflower tea compared to the placebo. These findings suggest that drinking passionflower tea may improve subjective sleep quality in healthy adults with mild sleep disturbances. However, the study had a brief time frame of only 1 week, which may not provide a comprehensive understanding of the long-term effects. A longer study duration would allow for a better assessment of the long-term effects and sustainability of the sleep benefits. Also, the study did not account for potential confounding factors that could influence sleep, such as lifestyle habits, concurrent medication use, or environmental factors. Controlling for these variables would help isolate the specific effects of passionflower tea on sleep. Passionflower may also help with opiate withdrawal. In a 2001 clinical trial, researchers randomly assigned 65 opiate addicts to 2 groups. One group received clonidine tablets along with passionflower extract, while the other group received clonidine tablets along with a placebo. The participants were monitored for 14 days, and their withdrawal symptoms were assessed using a scale. Both treatment protocols were effective in managing the physical symptoms of opiate withdrawal. However, the group that received passionflower extract alongside clonidine showed better outcomes for mental symptoms. These findings suggest that passionflower extract could be a beneficial addition to opiate detoxification treatment, but further research with a larger sample size is needed to confirm these results. 5. Passionflower may also help reduce coughing following extubation. Coughing after removing a breathing tube can lead to unwanted side effects. To address this issue, researchers explored the use of a medication to reduce coughing before surgery. A total of 138 patients were divided into 2 groups. One group received 500 milligrams of oral passionflower as pre-medication, while the other group received a placebo. The medication was given 2 hours before the surgery. After the breathing tube was removed, the occurrence of coughing was observed and recorded for 15 minutes. The patient's vital signs were also monitored. The 2 groups of patients were similar in terms of their characteristics, health status, duration of surgery, and vital signs. However, the group that received passionflower had a significantly lower incidence of coughing after the breathing tube was removed compared to the control group. This suggests that passionflower may be an effective pre-medication option to prevent coughing before surgery. Passionflower is usually safe based on most clinical trials. However, for some people, it can cause sleepiness, dizziness, confusion, and nausea. Pregnant women should definitely avoid using passionflower. It has the potential to trigger contractions and cause serious harm to newborns. Before taking any supplements, it is important to consult with a healthcare professional or your doctor. If you have a known kidney or liver condition, your healthcare provider may suggest regular monitoring of kidney and liver function through blood tests. If your trusted doctor recommends trying passionflower, you can find high-quality passionflower supplements on iHerb.com. Save up to 10% by entering APT0317 at checkout. This discount code doesn't expire, so you can cash in on it whenever you shop on iHerb.com. Just remember, what works for some people may not necessarily work for everyone. If you already tried it all and followed many doctors and health gurus, but nothing worked, you may find the answer by doing some digging into your genes. If you want to get to the root cause of some of your health issues, the first step is to find your problem genes. Taking personalized supplements based on your DNA may also help, and Self-Decode can help you with that. Self-Decode provides personalized health recommendations based on a combination of your DNA, labs, and environmental factors. There are just too many diets, supplements, and health hacks out there to waste your time and money on stuff that probably isn't going to work for you. So if you want to experiment in the most efficient and effective way, click on the link in the description box below to check out Self-Decode and unlock your own genetic blueprint.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!